Congress of the United States force you to buy anything. You say, they make me buy car insurance. No, they don't. The state does. The federal government does not make you buy car insurance because this is all the federal government's allowed to make you do due to Article 1, Article 1, Section 8 of the Constitution. These are the enumerated powers of Congress. If it's not here, they can't do it. So the question the Supreme Court had to solve in 2012 is, can they do it? They decided they did. They can do it. And the law was upheld. I advise you, if you want to have a good time, read Justice Roberts' opinion. You talk about splitting the baby. He split the baby 5 ways till Sunday. It is an amazing, amazing bit of writing to explain how this law actually stood. And the problem with the law is not the law. The problem with the law is how they chose to fund it. If they had funded it like Medicare and just taxed everybody, there'd be nothing for the Supreme Court to do. Congress is allowed to tax people. That's not what they did. They did all these penalties and all this other stuff, and I won't go into that. That's too deep. The most important thing that happened that day at the Supreme Court was the lack of necessity to expand Medicaid. This is a critical thing everybody must understand. The law basically said if the states didn't expand Medicaid to 138% of the federal poverty line, they lost the federal portion of what they were currently getting, because about half of Medicaid, more or less, comes from federal dollars. Many states decided, the Supreme Court said, too punitive, can't do it, you can decide to stay where you are or any increase you wish up to 138. So states like the good state of Texas decided nothing. So many poor people in the state do not have access to Medicaid. There are about 1 million people in Harris County or other surrounds that have no health insurance, which is outrageous. This is ground zero for health care problems. You're in it right here. You don't see it, but just go down to Bentob and you will. There was one more shot the Supreme Court had at the health care bill, which was in June. And as you all know, they did not take it. With 6-3, they sustained it. This was basically the argument that the law said that the subsidies people got who were poor to be in the exchanges had to come from state exchanges. More than half the states didn't have exchanges. They're in the federal exchange. It was a fine decision. But that's the end, probably, for the Supreme Court, I think. I will defer to you two. You maybe know more than that. I think the Supreme Court's done with the bill. Congress, God knows if they're done with it, for the most part. That's what King versus Burwell was about. The other thing you will hear, and did hear in 2012 between Mr. Romney and Mr. Obama, was ObamaCare and ObamaCare are different. Baloney, they are exactly the same. In 2006, the state of Massachusetts passed a law exactly the same as the ACA for all intents and purposes, where there are mandates to buy insurance, subsidies for the poor, and computerized exchanges to buy it. They're exactly the same. Why do I know? Because the people that put that law together came to Washington to work for Ted Kennedy and put this law together. They're the same people. It's the same law. For all intents and purposes, it's ObamaCare on steroids. So the last slide I want to talk to you about, I think that's enough. I don't know where the doctors are going to come from to see all these patients. I still don't believe you two guys are still working, but thank God you are. An insurance card is not health care. Card, C-A-R-D, care, C-A-R-E, not the same. I don't see why the insurers won't just raise their premiums, and they have. The requests in some states are astronomical because they underestimated the cost of Obamacare to the states. Okay? What happens when we realize that we're really going to die? That birth is a pre-existing condition? Because most people don't believe it. Not in this country. Just look at the commercials. You're going to live forever.
And you're going to be happy.
And you're going to be happy. You're counting on it.
Wait a minute.
So the question really becomes in the end, who is going to decide, was Sarah Palin right all along, are there going to be death panels? And the answer is there already are death panels. If you don't have insurance, you're on the wrong end of the death panel. And I think that's absolutely all I want to say about the slides. That's the gist of the middle of the book. Now I want to read a little bit from the very beginning and the very end, which will tell you why I wrote it. November 22nd, why I really went to Washington. This is the prologue of the book. For our parents, it is December 7th, 1941. For our children, it is September 11th, 2001. For my generation, it was always November 22nd, 1963. We all know where we were when we first heard he had been shot. French class, sophomore year of my high school in North Belmore, Long Island, New York. Much like the days I was experiencing in Washington 45 years later, the morning started gray, cold, and windy. The flags in front of Wellington C. Mepham High School stood straight out. It was the Friday before Thanksgiving. Christmas vacation was not far away, but that also meant that finals were not far away either. In the middle of French class, the door opened. A tall, lanky Spanish teacher named Senor Labar walked in and whispered in the ear of my short, crew-cut sporting French teacher, Monsieur Desjardins, should we tell them? Desjardins asked his colleague. Yes, the president has been shot. I turned to the girl at the desk behind me. She began to weep with her head in her hands. Class finished, and as we passed to our final period, the flag in front of the high school was still unfurled, but had been lowered to half-staff. My last class was choir. We sang the Lord's Prayer and went home. 2 days later, my parents, my sister, and I were preparing to go to synagogue. As all religious denominations were holding memorial services for the president that day, it was Sunday. The phone rang and my mother screamed down the stairs of our modest split-level house, "Turn on the television." We watched the first black and white replay of the televised assassination of Lee Harvey Oswald. My parents were in fear that the government was collapsing and there was a right-wing plot to seize control of the United States. It was less than 20 years after World War II, and the atrocities of the Holocaust were fresh in the minds of every Jew. Was this the knock on the door my mother had always warned me about? Since that day, an entire generation has been shell-shocked by a series of tumultuous and catastrophic events that were seemingly set into motion on November 22nd, 1963. We collectively careened from Vietnam to Robert Kennedy and Martin Luther King's killings in 1968, to Watergate, Iran-Contra, Monica, 9/11, Iraq, and the Arab Spring. Fighting to carve Israel out of Palestine began in the year I was born and hasn't stopped since. These events, built one upon the other, convinced my generation that the world is insane, bad things happen with some degree of frequency, and our leadership and government seems irretrievably corrupt and unable to protect presidential candidates or average citizens. We still don't trust anyone over 30, thus we no longer trust each other all that much. Perhaps that is what is incapacitating Congress. After the Wall Street collapse and Bernie Madoff, once again we baby boomers are left with a great feeling of emptiness. What happened to that country we thought we knew during the period from January 20th, 1961 until November 22nd, 1963, or was it all a dream? Many years later, I attended a black tie banquet for the Board of Visitors at the M.B.A. Anderson Cancer Center at the Four Seasons Hotel in Houston. The board is the Boosters Club for Anderson. It is populated by many prominent and powerful people from around Texas and the rest of the country with fond affiliations with M.D. Anderson, often based on the superb medical care given by the faculty. My wife Jeannie and I were seated at a table with John and Ann Connolly, the son and daughter-in-law of the late governor of Texas, who had been wounded that day in Dallas many years before. Their mother, Nellie, a great supporter of M.D. Anderson, for whom the breast cancer clinic is named, was there as well. Young John was recalling the day when he found out his father had been shot, but unlike President Kennedy, would survive. After a while, having listened to many stories about that day, I screwed up my courage and turned to Nellie Connolly. "Ma'am, may I ask you a question?" 3 shots from behind came back at me like rifle shots themselves, for she had been asked the question many times before and had come to terms with the answer. This is the end of the book. Andrew wanted to visit an exhibit about the 14 vice presidents who had ascended to the presidency. Andrew's my son. During the visit at the National Portrait Gallery, a block from our hotel, there was a television playing great speeches of presidents. President Kennedy's inaugural address rang out, and the clarion call to my generation was heard again. Ask not what your country can do for you, ask what you can do for your country. I was 12 again. My bar mitzvah was 6 months away. It had snowed 2 feet in the street on Long Island, and schools were closed that Friday. Thus, I was able to watch the inaugural address in black and white. I remember it as if it were yesterday. The torch was being passed, and now it is our turn to do the same. On the 40th anniversary of Woodstock, let's take stock. My generation has served in Vietnam, Iraq twice, and Afghanistan. First as foot soldiers, now as generals. We have sacrificed as others will sacrifice after us, and as our fathers and mothers sacrificed before. There is nothing new in this American experience. Perhaps there's also nothing new in my congressional experience. Members have been lackluster throughout our nation's existence. Staff may have run things while members were out eating rubber chicken and raising funds so they could do it another day. Perhaps it is my hazy recollections that differentiate the past days of Everett Dirksen and Mike Mansfield from those of Mitch McConnell and Harry Reid today. The latter don't seem to measure up to my memory of the former, but my memory is faltering. My generation of boomers has excelled, although our two previous presidents, Bill Clinton and George W. Bush, left something to be desired when it came to judgment and performance in the presidency. It is very possible that they may be the only two boomer presidents. Maybe this process is as it always was, as it always will be, and as it should be. Maybe I am just naive about Washington and the world. What did I expect? But that's the wrong question. The right question is, what do you expect? Maybe the boomers will make no more imprint on Washington politics than the other generations ever had. Maybe we'll take the Xers, the Yers, the millennials to make significant change in the way we do the people's business in our nation's capital. I hope someone can. Don't give up on this country. Besides, you can't. In this country, you are the country. It's still a great country filled with great people, and Washington is a great city, also filled with great people. As the boomers pass the torch, just as we taught you all how to rock and roll, grow your hair, and use psychedelic drugs, let us remind you of that day in January of 1961, 50 years ago to the day that I was writing this, when the president who saw us as our own, called us to action that still drives us. Each of us needs to ask the question again, what can I do? The work is never over. God bless the United States of America. Any questions, or you could just go for the sorbet, whichever you prefer. I go for the sorbet. Anybody have any questions at all? I mean, really, go ahead and ask. Yes, sorry.
Do you feel it should have been passed?
Yes.
Okay. I just wanted to be sure.
If I had the vote, I would have voted for it.
The alternative was not that.
Yeah, it's not like a land. There was no alternative. I mean, the problem is they shot low and missed. I don't know the other way to put it. It's a bill that did almost nothing. I mean, 16 million people have insurance that didn't have it before, they say. But probably 7 or 8 of those million people had some form of insurance and got dropped. For the people with kids under 26, it's great. I mean, for the people who didn't have access to health insurance before and now on the exchanges, it's great.
It's better than not having done anything.
Barely. The reason I say barely is, in Congress, when they touch something and they think they've got it done, they don't revisit it for 5 to 10 years. This needs to be revisited right now. There's no time to screw around with this, but it's like everything else, you know. If you've got insurance, you're in good shape most of the time, although God knows I've had my occasions to interact with the healthcare system. But for the most part, that's still true. But there's still a lot of people uninsured or underinsured. Still, the most common cause of personal bankruptcy in this country is healthcare bills. So it clearly has not done enough. Anybody else? Yes, Keith?
Is the bill going through growing pains, and will it cure itself?
No. No, because it's shot low. It can't, the big problem is we spend too much. We just spend too much on healthcare. And we've got to find a way to limit how much we spend while keeping the quality up.
Let's not force the hand?
No. There's nothing in this bill that's going to control costs. Yes?
Well, then what is the solution?
I think we have to go back and revisit it and admit a couple things. One, even if we just say we're going to spend $2.7 trillion a year on healthcare, which is what we spend as a country. If we're going to do that, can we not spend any more? You know, put a lid on it? And then say, well, does grandma need her 3rd MRI when she's in the intensive care unit? End of life care alone, if we would just address that, we could save millions and billions of dollars. I mean, how about this? Just something simple. If you have a driver's license, you have to have an advance directive. You don't have to say anything specific, you just got to have it. Give the doctors a break. Tell them what you want. You want to have everything under you, fine, but if you don't, leave him or her, excuse me, free to let you die. Because bad news, folks, everyone in this room is going to die. It's only a question of how and when, and how much. If we don't face that as a nation, we're not going to get this thing fixed. And every other nation in the world has done this. And they're not the same. If you want to read one book, The Healing of America by T.R. Reid is the best book on this that I know. It's a small paperback book. T.R. Reid was a very famous journalist for the Washington Post and took his shoulder around the world, essentially. And it's, every system is different. The Japanese pay for parking, the Japanese go to the doctors more than we do. It's different. Leslie,
What do you?
good to see you.
Thank you, it's good to see you. What do you believe is the likelihood of this being revisited and amended in some way?
I think that, I can't read the tea leaves on how the next election's going to go, that's for sure. Anybody who says they know what's going to happen is out of their minds on both sides, by the way. I mean, neither side is it locked in. And I just wrote a piece for my blog, lenzwelling.blogspot.com.